Hello, everyone. Welcome to the first Associates meeting of 2021 at the Stanford Institute for Economic Policy Research. I'm Mark Duggan, the director of CEPR, and I hope you all enjoyed the holidays and are looking forward to the year ahead with optimism. Thank you all for starting off the year with us. We have a really exciting lineup of virtual events on the horizon in the weeks ahead, in addition to today's discussion with Lloyd Dean. Just a quick preview on what's coming down the pike. On January 21st, we'll be featuring a talk with Jonathan Coslett, one of our advisory board members, who is also the Chief Investment Officer at TPG Capital. Vivian Lee, the President of Health Platforms at Verily Life Sciences, will be with us on February 8th. During the first week of March, we'll be holding our annual CEPR Economic Summit with an excellent lineup of speakers, including leaders from the worlds of business and economic policy, and sessions on the regulation of big tech companies, and much more. We'll be sending invitations out and more details about these events and the summit sessions really soon. But today, I'm absolutely thrilled and honored to be joined by Lloyd Dean. Lloyd is the CEO of CommonSpirit Health, one of America's largest operators of hospitals and health clinics. He was the president and CEO of Dignity Health and oversaw the merger between Dignity and Catholic Health Initiatives in 2019 to create CommonSpirit. While he led Dignity Health, Lloyd transformed the health system from a holding company to a dynamic enterprise with 41 hospitals and over 400 care centers, including neighborhood hospitals, urgent care facilities, surgery and imaging centers, home health, and primary care clinics. He also led Dignity's partnerships that helped create more positive patient experiences, more efficient care and services, and healthy communities. At CommonSpirit, he's at the helm of a massive nonprofit healthcare system that operates 1,000 healthcare sites in 21 states across the country. Under Lloyd's leadership, CommonSpirit is working with community members, lawmakers, and health experts to promote better healthcare and health outcomes for everyone. And he's very focused right now on ensuring that the incoming Biden administration addresses the pandemic in a smart and aggressive way. He's also committed to reducing racial disparities in healthcare and the medical profession. Just last month, CommonSpirit partnered with Morehouse School of Medicine, a historically Black medical school, to create a joint undergraduate and graduate medical education program to train the next generation of Black and other minority physicians. Given the challenges that the US is currently facing with the pandemic, major gaps in our healthcare system, and racial disparities, I can't think of a better or timelier speaker today than Lloyd Dean. You will have the chance to ask him your questions during today's event. Just send them in to the link on your screens, and we'll try to get to as many of them as we can. But for now, please join me in welcoming Lloyd Dean to CEPR. Thank you.
First of all, I just want to say thank you, Mark, and I'm very humbled and pleased to be here. And what a day for us all to be gathering. I think history will show that we will all sometime reflect back on this January 6th of 2021, because as we are gathered here at our nation's capital, there are tens of thousands of individuals there expressing themselves. We have a Razor event going on in Georgia that will help set forth the course of government in this nation for certainly the next 4 years, but most immediately the next 2 years. And we also come to this discussion at a place that this nation in our world has not been at since 1918. And that is one of the most devastating, challenging global pandemics that our generation has ever seen. So I'm very happy to be here with you. I look forward to your questions. Please, no holds barred. And again, this opportunity to share my perspectives and to hear your questions and thought is one that I treasure. I thought I'd just start by telling you just a little bit more about CommonSpirit Health and a little bit more about myself. And I'll start with myself because I think that how we lead, how we use this gift of life that we have is often driven by our aggregate experiences in life. Real quickly, I come from a family of 9 kids, I was born in the South. My father was in the military, got out, and like his father before him, migrated north from Montgomery, Alabama to Michigan. Why were African Americans moving to Michigan? Because there was opportunity there, and they felt that they had a greater opportunity at life given what was happening in the South. So the little community I grew up in Michigan was really a manifestation of a lot of African Americans leaving the South. In my community, there were no resources. We had no public resources. The whole story, I grew up on welfare. I was the first person from my community to ever go to college. And I tell you that not to, feel sorry for Lloyd Dean, but when we talk about healthcare, and we talk about what I'm doing with my life and where I've dedicated my life, they've really been driven by two things. The two professions that I've spent most of my life in. The first one was a teacher, and that was manifested because I never had a teacher of color. We were bused about 8 miles to a school, so you had this kind of really, really poor group of individuals being bused to an upper middle class school where we were like a 1%. And I can remember not being able to internalize it, but I can remember that the parents of and the grandparents and what I saw in the neighborhood where my school was so different than the neighborhood that I grew up in. The first health professional I ever saw was a nurse who did an athletic physical for me. And, in my community, there was no such thing as insurance and all of those kinds of things. So that kind of formed my interest in healthcare, and both of my grandparents died early, and I saw people in my community dying. But when you're a child, you really don't understand it. And the second thing, as I mentioned, I went to a school that there was no diversity in the teachers or any of the administration. So when I got out of college, the first job I went to, which I loved, and I'm a little bit jealous of Mark and Greg and folks, and that's education. And from there, moved into healthcare. So I'm glad to be here with you today. A little bit about just a couple of statistics, and then we'll jump right into questions about CommonSpirit Health. As Mark said, we have 140 hospitals. We are roughly a 30 billion revenue organization, scaled up. The actual number is about 146,000 employees. We have 2.6 million people in our value-based agreement programs. We do about 4.3 billion in charity care and community benefit each year. We have 25,000 physicians. We have 40,000 nurses, and we're in 21 states, and we serve a demographic of every demographic that we have in this country. So what's going on in the nation? The virus has it's 24/7 in my life. With the footprint that we have the capability of serving 1 out of every 5 Americans in this country. So Mark, I want to make this meaningful for our audience, and I know that you've given some thought to some things that you'd like me to reflect on, and back to you, sir.
Wonderful. So thank you so much for that background, and maybe we definitely want to get to COVID and vaccines and so forth and racial disparities, but maybe just to start off, maybe you can walk us through a little bit. CommonSpirit Health's clearly a big and important part of the U.S. healthcare system. Can you give us a bit of history on the company, like, for example, that led to its creation and how that came about?
Yes. Prior to becoming CommonSpirit Health, I was the CEO of Dignity Health, which was really in 3 states, California, which is, we're one of the largest providers in California, Arizona, in Nevada, and we had about 60,000 employees in a very prominent system in its own right. But our legacy organization, Catholic Healthcare West, which became Dignity Health, was founded by women religious. So who we are and our focus, our vision, our mission, and the values of the organization have been sustained through that transition. And then on the other side was a long-term, one of the longest serving Catholic ministries in this country. And everybody referred to it as CHI, but it was Catholic Health Initiatives. And quickly, how and why we scaled up to become CommonSpirit Health is, I was very much engaged in health systems and health ministry and Catholic healthcare and not-for-profit healthcare in the country. And one day after a meeting, Kevin Lofton and I, the CEO then of Catholic Health Initiative, we started talking about what were some of the challenges that we were facing. What, investments like in technology, investments in our people, investments in our community. How are we using our voice to advocate for, at the time, the change in terms of some kind of universal health or the ACA? And I was involved with the Obama administration. And again, to cut to the chase, we saw that we had a lot in common. And in addition to that, we had come together, even though we were separate organizations, and did a joint venture around precision medicine. But we also both were making substantial billion-dollar-plus investments in technology. And some of our foundresses, the women religious, were the same orders of women religious. So we just started talking about the duplication and how, the demand from consumers that we needed to be more efficient, but yet, cost was an issue. And since we had worked together, are there opportunities for us to be more powerful in the nation in terms of the communities that we serve? Because we both, from our mission and from our value base, really focused on the most vulnerable communities. Yes, we're in other communities too, rural communities, but we saw that geographically we had no overlap, but in many, many ways we had a common agenda. And so out of that, working with our legacy organizations, we created CommonSpirit Health.
Great, that's super helpful. And so can you give a bit of a sense of what are the key differences between a Catholic health system like CommonSpirit Health and the sort of standard nonprofit private healthcare system?
And that's always a tricky question, because sometimes when individuals like myself are asked that question, it seems like our answer is distinguishing. And I just want to preface my comments by saying that I think that there are tremendous not-for-profit, for-profit organizations serving this nation, and that we need all of those. And we work with many of them to create the infrastructure, the products, the services for communities. But one of the things that does distinguish us in one aspect is our focuses and our mission. Our mission is to serve the most vulnerable. That's why the women religious were asked to come to this country. It was very much at like a time that we're in now, cholera, where there was outbreaks in cholera and other diseases, and they were asked to help. So who we focus on in terms of the most vulnerable communities is one difference. But again, I want to be careful not to say that others don't do that. And we are rooted in our Catholic tradition and our Catholic heritage, and so we are a faith-based ministry. But again, none of that makes us better. It's just a different focus for us. So where you might find us delivering care could potentially be different than some of the motivations or some of the planning and architecture of others. But I'll tell you, Mark, what I like to focus on is where are the similarities? Because if there's one thing we should be learning from this virus is that we have to have a bold, a strong, an innovative, a creative, a community-based health infrastructure. And we're seeing where the deficits are costing lives, and we're seeing where we don't have an integration of community resources, the devastation that can be caused.
Yeah, and that is that's really helpful background. And one thing I'm curious about is if we can. So my next question is going to be on COVID-related stuff. But if you were to, it's hard for us to some extent to remember what the world looked like a year ago. But if you were to go back in time a year ago, what were the biggest challenges that you were? COVID, I know, is huge, and I want to attack that next. But what were the biggest challenges that you were facing then?
Yeah, and I'll answer it specifically, and then I'll be a little bit more global, because of the time frame that you said. A year ago, year and a half ago, we were knee deep into the merger. So when you have two major systems of our size and scope, and each of those individual systems had all of the things that you would think that individual companies would have, its own IT systems, its own infrastructure around HR, its own payroll systems, all of those kinds of things. So we were very much into integrating. And we had just come off of really forming and launching CommonSpirit Health. So we were doing the integration, but also serving the communities where we are blessed to be a part of. And from a fiscal standpoint, we were doing really good. From an integration standpoint, we were well on our way, combining again and selecting a single leadership team, all of those things that come with mergers of this size and scale. But most importantly, we were focusing on the reasons why we came together. Our building an innovative, creative, measurable, a clinical enterprise, integrating our physician capabilities, looking at what is the best of each of the legacy organizations in terms of how we serve, what service lines, what should our organizational structure be. So, but then comes COVID, and and I think anybody that tells you that they saw it coming, I'll just say are stretching the truth, and it rocked our world. We happened to, when the United States, most people knew about the virus. It was because of what was going on in one of our geographies in the state of Washington. We were the first notable case of the virus, and it didn't take us very long, regardless of what was said, to realize this is going to be big. And so we had to start pivoting in terms of PPE. We had to start pivoting in terms of ventilators, all of those kinds of things that you've heard a lot about. And then it just started growing and growing and growing. At the time, we were probably doing somewhere between 3,000 and 4,000 virtual care visits. We're to the right of 1.4 million now. So our whole world changed, and we had to pivot in real time. And remember, we were serving patients in every day. So That's what our world was like before that. Our world now is so different.
Yeah, and it is, and there was sort of, if you look back, and it's really been such an eventful year. It's just hard to grasp just how big it's been, and you and your team have been on the front lines of this. Can you walk us? There's sort of been, my sense, and I guess it varies somewhat across geography depending on where you are in the U.S., but sense is we've sort of had 3 waves: the spring, then we started to fall somewhat in terms of daily cases, rose again during the summer, started to fall again in terms of daily cases, and then right around Thanksgiving, or maybe soon after Thanksgiving, we really have taken off to where higher levels than any time last year in terms of daily cases. Can you walk us through a little bit?
And it's something that I think about every day. It's something that I tell people, because they say, man, you must not be getting very much sleep, and I say, I don't sleep. And when I do, it's with one eye open, because this has just been all encompassing. But when it first started, we thought that, okay, there's something here. We've got to get the organization ready. We got to make sure that we've got the resources to protect our caregivers. We got to make sure that we've got the resources to serve those that are presenting themselves at our hospital. And that sounds like, okay, that's an easy check the box. But as you know, most of the PPE in this country was not manufactured in the continental United States. So that protecting your employees and protecting your patients became a very challenging thing for us and for the nation. And making sure that we had the ability to move. One of the great things about being a system and being in 21 states is that when there was this national shortage for, let's talk about ventilators, we had the ability to move ventilators from what I'll call a low density in terms of positive cases or individuals in our ICUs to other geographies. But the numbers began to multiply, and that began to be a challenge not only for us, but for the entire nation. So then as it began to grow, we got to the point of having to shut down surgeries, because, and remember, at the time, initially, how we even treated patients is different than how we treat patients now, clinically. Because we were learning so much about this virus. I don't want to call it as we went along, but as we went along. So the treatment methodologies are different today. So that was a big spike. That was what I'll call major surge number 1. Masking, people initially began to really take it pretty serious. And then for a whole host of reasons in terms of politics and fatigue, we began to let down. And we actually began to see, because of the initial attention that the nation and communities paid, we saw a dip beginning. And we go, wow, this is a good thing. What we're doing is working. But we also knew that as we looked around the world, that there could be another surge, and we didn't want to get caught in surge B like we did in surge A. So we began to access, to acquire resources. We began to work throughout the state with others, and then we began to participate in national discussions about how do we make sure that we logistically can get resources to where they're needed. So for a moment, a couple months, we kind of had that kind of decrease, and then started on the journey to where we are today. So we kind of have, but running parallel to that was the beginning of the developments of a vaccine. And also running parallel to that was all that was happening in the nation around racial justice. You had the George Floyd situation, and all of that began to be happening at once. And that was when we really began to zero in on something that you mentioned, and that is that what chronic conditions that we've been talking about in this nation for decades, and health inequities and health disparities, and we knew that certain communities and certain ethnic groups were just not getting the kind of care and didn't have the health infrastructure that they needed. And we knew that, we began to see deaths, and quickly saw that, an example, in the African American communities, and that Black citizens were dying at a disproportional rate to other groups, and that other groups of color also. So all of those problems that we've been tinkering around with, really the virus just brought them to the surface. So that became another issue for us. How do we get resources to those communities? How do we get focus on that? And then you had, simultaneous to that, is the economic shutdown of the nation, and that impact on caregivers, family members having to make a decision: do I go to work? Do I stay home? Schools shutting down. How do we take care of our children? How do we get resources into the community beyond the healthcare environment, so that people in other walks of life and other disciplines and sectors could protect themselves? And the rest, it's just been an increasing the severity, the number of positive, and testing. I could do a whole hour with you just on testing alone, and there were a communication breakdown and a lack of clarity about what's the role of the federal government, what's the role of states, what's the role of the local communities. And remember, while all of these, quote, problems are being discussed and worked out, the number of deaths, the number of positive cases are just escalating and escalating and escalating. And that brings us to where we are today, Mark.
Yeah, that's really so interesting. And I think, one thing that I've wondered about, and you just mentioned in the last sentence there, federal, state, and local, there have been different policies that have been implemented. Obviously, you operate in more than 20 states, so you've seen many approaches at the state and local level, and we've had the federal approach. And I'm curious, in what areas do you think policy has been most successful, and where do you think we've fallen most short?
I'll go backwards with purpose, because I think the most successful thus far has been the warp speed development of a vaccine. As it relates to this virus, I think history will show that the pace is unprecedented in the world. The efficacy and of the what we know of the vaccines, plural, thus far, I think are exceeded everyone's thoughts about what could be done in such a short period of time. Going backwards is, I begin to give you my cascade of problems. The biggest problem that we had, from my perspective in the nation, was a lack of clarity around accountability and responsibility. And it took a while to get a realization that we saw in our hospitals and in our communities and in the healthcare sector, to get a realization that this is not going to go away on its own, and that you can't leave it up to each state, because the resources and the needs at the state level exceeded the capacity of the states, and then just start breaking that down. Individual health departments and counties just didn't have the resources to deal with this, and it took time to garner that. So I think a lack of a definitive, I hate to use org chart with who's accountable for what, was a huge problem. Getting resources to communities, getting resources in a plan for businesses, both small and large, getting the cooperation that was needed to begin to ensure that we have enough resources to treat people within our communities and in the institutions. All of those kinds of things were contributors to a very difficult situation for our nation. And we are still dealing with a number of those challenges. But think about something as basic as testing. For us to know who was getting the virus, where and at what levels, when, makes it really difficult for us to be able to have treatment methodologies and plan that could be mobilized to begin to control. So the fact that the spread went like waves across the world, and certainly across the United States, and not until well into the process, and we are still in some communities, we don't have adequate testing, has been a very, very overwhelming, disappointing, and challenging for our nation. I mean, it brings tears to my eyes every day when I think about and see the numbers, not just within our 21 states, but when I see the numbers in the nation of new cases that I believe with some clarity and accountability around washing our hands, social distance, all those kinds of things that we did have at our disposal, and not to have those applied in a way that could help you, not only protect you, Mark, but protect those that you came into contact with. I think these are all lessons learned that hopefully there'll never be another pandemic, but I think that we can all do better, including us in the healthcare sector. And I think this nation and its citizens should demand more planning, architecture, implementation, accountability, and clarity around how something of this magnitude would be dealt with.
Yeah, thanks so much for that. Yeah, the human cost of the pandemic in the U.S. and around the world has really been, like, as you were saying, staggering, with more than 340,000 people in the U.S. now having perished. Over 20 million people have gotten COVID in the U.S. It's staggering, the numbers, and it is deeply frustrating, I'm sure, for you on the front lines and many others, to have the sense that we probably could have done better job as a nation on a lot of things, and not been at 340,000 and not been at 20 million. But hindsight's 2020 with a lot of this stuff. But one thing, the human toll that this has exacted on people, on families, is just gigantic. But one thing that I haven't heard much about, and I'm curious, in your role as a leader, how has this affected your staff, your physicians, your nurses? I mean, I would imagine this has just been like totally exhausting, emotionally, physically, and how have they dealt with it? And what have you done to try to help them navigate, and so that they can be, warriors, helping to fight the pandemic on behalf of their patients?
As we are gathered here today, one of the greatest challenges that we as a nation are dealing with, we as a healthcare sector are dealing with, and we as CommonSpirit are dealing with. And you heard me talk about 40,000 nurses, 25,000 physicians, is their wherewithal and their health. And what I mean by that is, imagine, this has been a year straight for them. We have had employees that themselves have died. We have had hundreds and hundreds of employees that have tested positive. We've had employees who've had family members while they're at our institutions and in our access points and at hospitals in our community, serving others, are finding themselves that their loved ones are either institutionalized or so sick and in ICUs and yes, dying. The fatigue, we have been asking physicians and our nurses, but all of our staff, they have been going 24/7. And I do not have a good enough command of the English language to communicate what it is like for nurses and physicians and clinicians to be in a situation where they are the last one who communicates or who sees a family member's loved one pass. And they are there holding the hands. The pace of walking into a unit, walking into a floor, and you can barely get through because there are so many gurneys and so much need, and that, and you can hear in the hallway people gasping for breath. And to be exposed to death, to be exposed to what they are facing day in and day out, and simultaneously dealing with the economic challenges of homeschool learning, the economic challenges of a spouse may, because their business has shut down. And what we are seeing is, and then I'll get to what we're doing about it, not just a human toil on the physical side of this. And our people are well trained and they are so dedicated, and many have and would give and put their own lives on the line, but mental fatigue. And this is not going to just stop with the vaccine. And if you talk to people that have been in the military or been in wars or have been in situations like this, I'm deeply concerned about not just what's going on today, but a year from now and 2 years from now. And the resiliency that our caregivers, and not just ours, caregivers and EMT and firemen, and you can name it all around this country, have shown is the best of humanity and the best of our country. So what have we done about it? We early on began to put in place support programs, that had economic pieces to them to help provide for our employees, in terms of time, PTO, and things that people needed. We suspended a lot of our programmatic regulations to deal with the reality of the world that we were dealing with. So support there. We tried to work in communities to get daycare, to get support services so that people could go to these challenging situations. But, you know, and we've done a lot, and we've done everything that I think that a system of our size and small hospital, rural hospitals could do. But I don't feel it's been enough, Mark. I just don't think it's been enough. And so you might say, well, what else would you have liked to have done? And there's a shortage, and nurses have gotten sick, and they just, in physically, you know, putting one leg in front of the other, and physicians to get there. So I think one of the biggest challenges that we face right now, and I'm in LA. I'm here right now. These decisions that are having to be made, and you've seen them on the media, in the media around life or death situation. If someone is showing signs that they just aren't going to make it, you cannot bring them to the hospitals. Imagine making that kind of a decision. Imagine that you have EMT individuals driving around a facility waiting for a bed because there is zero ICU beds, but you've got, you know, thousands of people waiting in getting to a point where they need to be there, driving around for 6 to 7 hours before you can enter a patient into care that they so desperately need. So that's the reality of the world that around this nation we're faced with. And I think that, you know, I'm hopeful that we're going to break the log jam with vaccinations. And I know there's people that have different points of view about vaccinations. But I will declare I'm one of those that think it is a tool and an option for us right now that we need to reach out and address and to engage in, because this virus, and you've heard about all the different mutations, and I'm on committees that we talk about this daily, and we get updates from the CDC, et cetera. We've got to get people vaccinated. This is not going to just go away on its own, and we cannot continue at the pace that our caregivers are being asked, and we just don't have the institutional capacity, and we cannot have loved ones and people dying and perishing at the pace that this nation is, and we have to get control of this virus.
Yeah, that's your insights there are so fascinating and also moving. And we've got a lot of great questions from the audience. I'm going to ask you one more of mine and then pivot to audience questions. But there's obviously a lot of interest today and generally in what's happening in DC. And who knows, I think stuff's happening like literally as we're on this event. But how do you, on that DC front, how do you think federal policy will be different? So 2 weeks from today is inauguration, and there will be a new administration, a Biden-Harris administration. Can you give a sense of whether, like, what will be the changes in federal policy that are most impactful that you'll see?
Yeah, and I'm going to, if you will, bridge my answer by what I hope I will see. I hope that number one is that there will be a focus on doing those things that we can to begin to get control of the virus in an organized way and save lives. So I think in terms of vaccination, in terms of support to the states, to the local community, I think garnering of resources and direction and policy and executive orders to get vaccine out there will be one thing. I think Also, we're going to see a mass, if you will, initiative around additional federal resources coming to the communities. I think that we're going to also have to have some more accountability around helping small businesses, and I think that's going to, we have to get people back to work, we have to get people back to school. And I think if we haven't learned one thing throughout this whole virus, it is the importance of having a strong, robust, inclusive, equal, fair, and just healthcare infrastructure and capabilities for our communities. This virus saw no color, it saw no ethnic scale, no economic scale in terms of we passed over the wealthy. It was agnostic. And I also hope, and this wasn't part of your question, that as humanity, we have also learned that what happens to Mark in his health and his availability of fair and just health care is not just good for Mark and his family, it's good for the community. So we are connected as human beings in a way that defies all of the guardrails in the segmentation and racial and all, more so than we ever have been. And what happens in other parts of the world is important to what happens in my neighborhood.
Great. Okay, so I'm going to draw, I have a bunch of great questions here from our attendees.
And I'll give you much shorter answers, I promise.
No, we're good. So we, obviously, a lot of the people who are tuning in are here in California. Mm-hmm. And I think in California, people are pretty surprised by the trajectory that the virus has taken here in the state, especially given, we've been among the more aggressive on the sort of lockdowns and all that. So can you talk a little bit about what you think is driving what we're seeing here in California, and then also, just related, I'm going to try to bundle a couple of questions here. One of our attendees is curious about why California is so low in terms of hospital beds per capita relative to other states, and why is that the case? So sort of two questions in one on the California front.
Okay, first of all, in terms of the why California, there's a whole host of reasons, but I would put them in this bucket. Number one is that even though we were doing all those things that you mentioned in terms of the governor taking some strong action, just given the geography of California, given the weather here, there were still people that just were not compliant, and they just said, "Hey, I'm out in the sun. I'm away." So we've got more non-compliance than I think a lot of people think. Number two is density. I think when you look at where the huge early on spikes and the biggest challenges of the virus was New York. You saw it there. You see it in Los Angeles. It tended to go to the metropolitan, high-density areas. Why is that? Because you've got higher concentration of people. We've got tens of thousands of people homeless. So I think there are a whole set of factors there. I'm not so sure that, and we saw proportionately some of the same positive levels in other geographies. It was just how the geographies dealt with compliance in those kinds of things. I also think that testing and the amount of testing that needed to be done in certain geographies, certain communities did it better than others. And I think you saw, and remember at the beginning, states were on their own, so it was a state-by-state thing. And I think that Governor Newsom and the team here jumped on it really quickly. So I don't have a diagnostic answer. I read and I hear from the CDC all the same things that everybody on this call, that it was about compliance, it was about density, it was about having the right resources in the right place at the right time. The second part, of your question about hospital capacity, believe it or not, if you look back over the history of California and of LA County, while certain pockets of certain communities may not have had enough beds, etc., the statistics would say that in terms of utilization and our ability to handle the throughput, the community-based, the public sector, the private sector, California and LA County has done a pretty good job. But I think the way the virus, and in those communities that really needed the resources, because we now can retroly look at how these hotspots and where they were, many of those communities did not have the adequate number of beds. And the other issue that you have is you have large geographies here and populations that are spread out, even though you have the high urban densities. And most community-based hospitals were not equipped and have never been called to have as many ICUs, ventilators. And so you had all of this movement. And California is a very mobile population. So as people were moving around, so was the virus. That's my perspective. Others would probably beg to differ and have other reasons, political or whatever. But from where I sit and having access to data, that's what I would say.
Okay, great. We have a bunch of questions on the vaccine. So on the distribution of the vaccine, can you talk us through a little bit? We now have multiple vaccines that have been approved. How that's working? What are the challenges with respect to that, and who goes first and all like that?
Yeah, and I would say, and I'm not in any way. I'm trying to stay away from politics, but there was assumption that as the vaccine was being developed, and that development was progressing, that simultaneous to that was a very well thought out distribution plan in terms of how the vaccine would get to the communities and ultimately how the vaccine would be to get into our arms. And once we learned about the requirements, of the Moderna versus the Pfizer, there was a period of time where there was a mad rush for making sure that we had the freezers and all of those kinds of things. And this is just factual. While the aggregate number of vaccinations were planned to be purchased and distributed, the logistics of that in terms of what happens when it leaves Pfizer and gets to a state and who has the control of that vaccine and who's responsible for the distributions, we're living the bottleneck to that right now. One of the things that I think is embedded in the question is also the issue of a reticence that people are talking about in the nation about people that wanted to wait and see, or and some people that have even said that I'm not going to take the vaccine because I think the whole thing is a hoax. I get a little hyped up about that one because one of the things I can assure you is the number of deaths in the families and the people that I talk to. I almost lost a brother. I have friends that have died from the virus and family members. It's not a hoax. Yeah, but you know, that is a challenge. It's one that you know, we're dealing with, and a lot's going on in communities of color for some of the historical challenges that have happened around a vaccine. But I think we're going to get through that. I know for a fact that, again, there's 24/7 planning going on with the next administration to pick up on where we are. I know for a fact that the states, the governors, this last week were given the authority, responsibility, accountability, and the sense of urgency to unleash regulatory things that are blocking getting the vaccines into communities, and things like being, you know, if you have, if you've got too many shots of or doses of the vaccine, up until recently you couldn't, and I don't have enough, you couldn't send them to me. But so a lot of those logistical things I think are being worked out. And you know, other nations are tripling the number of vaccinations that we are doing, and I think it's methodology, it's planning, and it's engaging the full community, and I think we can catch up. But every second, I worry that we don't move this all forward as another life lost, and these are tragic, a tragic environment for us to find ourselves.
Absolutely, and yeah, it is. It's so painful to watch it unfolding, but it's great to have leaders like you on the front lines of this.
And I would just say, you know, one thing, Mark, you know, I just want to make sure that I say this, is that we, you know, we're a 24/7 media, internet, social media, television country and world. And what I worry about, and what is different with caregivers and people who have lost someone, is that I think people are beginning to get numb to the numbers. Okay, it was 200,000, it's 300,000. That's a family, that's a life, that's a brother, a sister, that's a mother, that's a neighbor, that's a loved one. You know, when I authorize trucks that have refrigeration capability, not to store the vaccine, but to store bodies, it's real. It's real.
Yeah, I can't even imagine. You know, we read so much and we hear anecdotal accounts, but you do, in your position, have a sort of big picture in a way that very few other people do. So let me just ask one final question. You know, we're seeing, you know, a lot of the big increase in cases, and you know that a big limit in all the 21 states you operate is, let's say, nurses and beds. And how are you thinking about, like, just going forward? Like, what is you know, trying to address the still further increase? Because
we're doing a lot. Number one is we are doing everything that we can to bring in resources from one place to another one where the numbers may be lower. So this mobility. Number two is that we are calling upon the governors to bring in additional resources from the military and from other places in terms of medical support. Number three, we are being very innovative in terms of how do we utilize the spaces, the floors that we have. Number three is that we are limiting so that we can take care of the most severe cases. We're having to make decisions around selective kinds of surgeries and those kinds of things. To get to the issue of staffing, we are calling for retired nurses. We're calling for physicians. We are utilizing our clinical staff to their maximum. We're looking at, because remember, at the same time we're treating all these cases, we also have to vaccinate the nation. So we're working with states on who actually can do the vaccinations. You know, in some states now you have EMTs that can do it. As a physician said to me the other day, Lloyd, even you could do it. And I didn't know if that was a compliment or, but I think his point was that, you know, we can't just limit this to just nurses and certain clinicians. We're never, if we continue at this pace that we're currently on and don't address the problems that I've talked about and the questions that I've responded to, it could take us 2 to 3 years to vaccinate the whole nation. We don't have that kind of time. So we're being innovative, we're being creative, and we're working with others in the community. It's not about what CommonSpirit Health or Dignity Health is doing. It's what is the community doing, each and every community, to accelerate, to set up sites, to do mass vaccinations, to make sure that only those who are coming to our facilities are the most needed. And telehealth, history is going to chart that telehealth and telecapabilities, which we ramped up almost literally overnight across this nation, has been one of the key saviors of lives and has helped in our ability to, even though we've talked about the problems of having to make life and death decisions, but we are able to treat more people because we can treat them in other venues and we can monitor them at home in a way that this nation was not scaled up to. So I know, Mark, that I'm over your time. So there's just the one takeaway that I would like to leave with everyone that is listening is that we're going to get through this. And I'm very optimistic. I agree with that these next 3 to 4 weeks are going to be some of the most challenging this nation has ever faced. And I'm not talking about what's going on in Washington, D.C. I'm talking about relative to this pandemic. But if we understand that this is real, if we take advantage of the treatments that are there, if we set aside politics and focus on the importance of life and the strength of our communities, we can do this. And even though we've had all these problems that I've identified, this nation around the globe, and particularly this nation, we have the capability, the ingenuity, the resources, the know-how. We can get this back in order, but it's going to take each and every one of us.
Thank you, Lloyd, so much for your remarks today. And really, honestly, I mean, thank you for the work you're doing every day, every hour, every minute, to you, to your staff who are trying to help patients, their families, the communities. I mean, the human toll of this has just been really staggering. And it is, to me, honestly, comforting to know that you are, are there and doing your absolute best to, on behalf of your patients and your staff and families and so forth. And, it was incredibly insightful. And I know also that many of us here today are thinking about the events that are unfolding right now at the U.S. Capitol. And we're definitely in an extraordinary moment in history, both because of the pandemic and because of the political things that are happening. And all of us at CEPR are really looking forward to engaging, hopefully, with policymakers and leaders like you from the business community to help make economic policy and policy more generally a little better. So thank you so much.
Yeah, and thank you, Mark. Great job. And we're better than this as a nation. And I'm fortunate to be the voice for almost 50,000 people that are the true heroes. And I think it's the teachers, the community workers, the EMT, the firemen, and there's so many people that I'm humbled by. So I'm one spoke on the wheel, but they are the true heroes. God bless you and everybody. Stay safe. Wear your mask, social distance, and I hope you see your way a path forward to take the vaccine, because we need every measure we can to get this under control. God bless you all.
Absolutely. Thank you so much, Lloyd. And thanks everyone for joining us. And we hope to see you again soon.